Case number 1. Everything is disordered anyhow. Anyone. If I do not give any symptom, only hint is everyday case. It is everyday case. I practice in somehow in rich area. I am giving you hint. But you will still see every day this case. Anyone please. Right or wrong is not important. Quick, quick.
Hello? The scabies.
Excellent. I will be more happy to say genital scabies. Second. This is classical. Everybody of you can see. Can I have pointer? Okay, not needed. Can you see the papule, a little bit of a cycle, burrows somewhere? Classical, same patient. Next one. Why this? Practicing for last 45 years, I am very happy. I am surrounded by full doctors. That is the reason I am successful. अच्छा हुआ सर महेश भाई और आप लोग नहीं है, नहीं तो मेरी वाट लगती राजस्थान नाडुल में जाकर के रहता. People apply micro. See, everybody can afford to make a mistake. I will tell my mistakes later on. But then everyday job, every one of you know about scabies, burrows. Any female coming, literally scratching like this, you did not even see this and that. Scabies. Like this, sorry for doing this. It is a scabies. I even don't think about fungal infection. I don't think about anything else. Just examine and it will be scabies. Micronesal, wastage of time, money, talent, prestige. Oh, this patient had come all the way from Rajasthan. Oh, HIV positive, scabies. Oh, another patient, scabies, scabies, scabies. Pause. If you don't read anything, what will be your diagnosis? Right. Come on, you go by approach, go by photo. If this patient comes to me, my first diagnosis, herpes zoster. Nagini, Karuta. Herpes zoster, na? Herpes zoster. But then everything clearly is written. All that mimics, all that glitter is not gold. And this is one example. Proper history, proper itching, proper examination, and everything is written. Just see. I will come to the treatment part. Wait. Message number 1. Whether you are of a sulfur ointment, benzyl benzoate, whether of gamma benzene hexachloride, whether ivermectin local or whether local permethrin. Book says apply after 10 days one application to all family members. My personal experience, twice a day for 3 consecutive days, and then maybe after a week or so. And when I say all family members are to be treated, how many of you know one entity, all family members to be given albendazole? Threadworm. Threadworm in one family member and all has to be given albendazole. Male and female partners, married one, or even for that matter unmarried one. Every one of you know. Infective leukorrhea, we give treatment to both male as well as female. Here also, all family member. Last point, genital scabies. Once local application, oral ivermectin is also effective. But once scab is over, still they get itching, and for that, hydrocortisone or mometazone or any mild steroid twice a day, 3 to 5 days, good enough. Last concluding point. Liberal use of antihistaminic is the need of an hour. I use the word liberal to the extent of sleeping. I repeat this sentence because their main symptom is not burrows, not papule vesicle, not excoriation, nothing, itching, Itching, itching. That has to subside. And I give liberal dose till they get serious. It can be Heterex, it can be any, even CPM of old days, even Bilastine of current one. Oh, Cadbury for everyone. Huh? Don't go with slide, go with common sense. What one thing strike? Every one of you know, if this patient comes to my OPD, gloves dermatitis, contact dermatitis, detergent dermatitis, some contact dermatitis. Yes or no? And see the whole story. This patient will not come with itching. This is a scabies. This is Norwegian or vagabond scabies. And what is beauty? I will treat this case as an eczema, as a contact dermatitis, or wrongly as a psoriasis, with mild or any type of steroid. And trust me, I will be in jail. What does it mean? It will flare up. If you scrap these, you will have trillions of sarcoptes stebi. And to see this type of cases, either you have to work in institution. If anybody sees Norwegian scabies, my phone number will come later on. Please report to me. I will give you whatever amount you want, so that at least I will have a record of a Norwegian scabies. Before I go to Kabra, I will be very happy that somebody has seen a case of Norwegian scabies. Sir has seen, see, we will talk this point. Sir will talk. Oh, Baba Adam ke zamane ka. Now this gentleman is chartered accountant. In fact, he looks after my file, which is very meager, very poor one. But if you see, not clearly seen, sort of a blepharitis, white powdery like, you will not be able to appreciate. So the mother comes, बच्चे को लेके आता है, साहब देखो ना, साहब क्या देखेगा, मेरी तो विजन पुअर, अभी भी पुअर है, उस समय मैंने तो और भी पुअर थी यार, कुछ नहीं मालूम पड़ा. Mother telling, look very carefully. And I thought must be squamous blepharitis. Mother is telling, moving. Lice, pediculosis. One more photo, please. Next. Oh, wonderful. This is Mukesh one. I had seen lice almost every part of body. Scalp, eyebrow, eyelashes, beard, mustache, axillary, wherever hair present. I had a pause for pubic hair. Anyone of you know what is the treatment for pubic hair pediculosis? I must have seen not less than 200 cases in my practice. Anyone, adult one. Don't apply anything. Shaving. Remove the pubic hair and things will be absolutely all right. And my practice started way back to 1980 till HIV had made a havoc around 88 or 89. Only and only yesterday, I can openly tell in front of everyone the cases of gonorrhea, non-gonococcal urethritis, syphilis, lymphogranuloma venereum, soft sore. The amount of number of cases at private level I had seen, I am sure nobody had seen. Now the message is what? When you have in pubic area, little economical, you can earn little more. Treatment is nothing, shaving. They all enjoy Rangarelia. Sorry, that's one. Next one please. The treatment of lice, every one of you know. Medical, I want mine. Removal mechanical, I want mine. Kerosene application, I want mine. In my village, you know, we used to give one chapati somewhere here. Bandar used to come. And they used to find out lice and used to eat away. Anyone? Sir, any experience? No? Nothing? Yes, this was that is the real treatment. Mechanically removal, they have so sharp eyes and hand coordination. Sir, it's wonderful. Otherwise, one good application of permethrin. If you want to dilute 5% to make it 2% if not available, put some water and apply. Again, not 10 days interval, in between also. One more thing, I had seen, namely in children, pediculosis lies over the scalp more with lymphadenopathy. The kid keep on scratching, from nails some bacteria goes and you get lymph nodes. So they come with lymph node. Close inspection will tell you, oh, problem is in scalp. Oh, this is good. Sir was talking about Dilip Thakkar, Dr. Dilip Thakkar. Yes. Yes. So one of another good student of Dr. Dilip Thakkar, Dr. Kucheria. It is MD in Ayurveda, exclusively practicing dermatology. Exclusively. At Bangalore and somewhere at New Bombay. Since he did anat, physio, patho, pharmac, medicine under my care, so this was a case, fumbled one. So he said, sir, ये क्या हो सकता है? Anyone? Okay, very good.
Plaque psoriasis.
Huh?
Plaque psoriasis.
Plaque psoriasis. I give you Cadbury, even if you are wrong.
Plaque psoriasis.
Yes, even if you are wrong, I will giving you Cadbury. But if you see very closely, since he is a dermatologist, like all doctors having running nose, they think first about CSF rhinorrhea. They don't think about real simple cold. So he also thought about, he's a dermatologist. So he thought about bullous diseases, childhood bullous diseases. We will not go into that detail. So he was thinking about biopsy. I said, ठंडे दिमाग से सोचते हैं, बायोप्सी बोलेगा पेशेंट भाग जाएगा, give a course of antibiotic. And now he is my student, so he always takes the mobile number of all family members. ये जल्दी हाथ में आते नहीं है, so he's waiting for biopsy, will come tomorrow, day after tomorrow. He had given one antibiotic course. I said, you give proper antibiotic course in proper dose. By third day, उसका बाप बोलता है, सर कुछ बायोप्सी वगैरह का जरूरत नहीं है, आपको अपने पर कॉन्फिडेंस नहीं है, आपकी दवा मस्त काम पे लग गई है, and almost everything clear. Now anybody? I will think about it, as you rightly said. Anyone now? Antibiotic. Quick. इसके पहले वाला दोस्त, face वाला थोड़ा. This one. This will give you some clue. If you see the nasolabial area, honey crust or little, sticky, crusty one. Now, sir, आपको नहीं सर, आपको सर पैर छूता हूँ सर, please. सर से तो आपको सीखना ही, जल्दी करो यार. अरे एक क्योरेबल है, try to understand. Scabies क्योरेबल है, पेडिक्यूलोसिस क्योरेबल एंटिटी है. This is a curable entity. 3 days of good antibiotic, by 4th day everything will clear, not even local antibiotic cream or lotion or anything. सर आप ही बोलो जोर से भी. Impetigo contagiosa. नाम पढ़े, दर्शन खोटे. When you learn dermatology, 200 pages are dedicated on, don't write. Infection in epidermis, infection in dermis, in bacterial, and bacterial infection in epidermis, dermis, and deeper layer, fascia, and hair follicle, sweat gland, and sebaceous gland. And the name are so big that you go into that flow. Furuncle, carbuncle, boil, superficial folliculitis, deep folliculitis, ichthymia, impetigo contagiosa, erysipelas, periporotitis, and hydradenitis suppurativa. They all are nothing. Categorized basically under the bacterial infection of a skin-related structure. Wait. What is the treatment for impetigo contagiosa? Good antibiotic course. I repeat. Many books say that impetigo is just epidermal epidermal is avascular, antibiotic will not reach. Trust me. Some of the book says what? God only knows. Trust my experience of 45 years. No local, only oral. No local, only oral. So this is very interesting case. Anyway, go by approach. First photo says some ulcer. Yes or no? It can be traumatic, it can be that, it can be that. And then you see, literally plastic surgery done. Graft is put. I give you a hint. These are difficult cases. In fact, I should have one more image. This patient landed just 3 months before, 85-year one. Creatinine was little high. So the family got upset and sir abhi kya karne ka? And basically this patient had, if you see clinically, cellulitis like picture. But that old person was looking little toxic. GC was not good. He said, forget about that marginal elevated creatinine. I am not concerned with this. I am concerned with food, cough area. And this was a case of, hint is given. Where is the hint? No. Necrotizing fasciitis. How many of you heard necrotizing fasciitis? So, आयुर्वेदा में पैसे के बारे में बात नहीं करते ना सर, वेलेंटियर सर, लेकिन जमाना सर अभी थोड़ा सा बदल गया है. मनी माइंडेड होना चाहिए कि नहीं? पैसा भी तो मिलना चाहिए ना यार. नाउ यू कैन इमेजिन कितना पैसा मिला होगा. मेक ए प्रॉपर डायग्नोसिस, call the team of doctors, incise it properly, debridement, followed by involvement of plastic surgeon, and wonderful plastic surgery. We don't care about creating it. That all will come 2 to 1. Oh, this is, इतना फटाफट लगता है मालूम है, 45 minutes से मालूम है. OT Cadbury. Oh, young boy, maybe around 15 years. I had not seen this patient. इस OT में मेरे को डॉक्टर महेश ठक्कर है, सर्जन ने मेरा बुलाया मेरे को, बोला बहुत हाथता है तू रे डरमेट में तेरे लिए केस रखा है. So patient was in operation theatre for some other purpose. He said, if you can make a diagnosis, you will get a Cadbury. I said, okay. So around 1 o'clock, I was in OT. Anyone? अनुमान लगाइए. You may be right, you may be wrong. Anyone? अनुमान तो लगाओ ना यार. See, you can see scaling, little erythema, tip of nose. अरे डर्मेटाइटिस तो बोलो ना यार. So कभी नाक के ऊपर वाला स्किन में सोरियासिस नहीं होता है, वो तो बोलो ना यार. झूठ तो बोलो ना. Yes, this is difficult. अब मुझे क्यों आया? मैं तो बेवकूफ हूँ, अज्ञानी हूँ. आप तो लोग बहुत ज्ञानी भी हो. ओ इमेज देख देख करके इधर उधर का सब. गूगल का डेज तो लास्ट 10 इयर्स का है. ये मेरा केस होगा कम से कम 82, 83, 84 का है. कोई तो झूठ बोलो. 10 सोरियासिस वाला कुछ तो बोलो. अरे कैडबरी मिलेगा, झूठ पे भी कैडबरी है इधर. क्या बोला? अरे बस सही बोला ना तुमने यार. क्या लगाने का अपने को? स्टीरॉइड है ना. डर्मेट में क्या है? कुछ नहीं आया है. डर्मेटाइटिस बोला, स्टीरॉइड लगाएगा. तू भी जेल में जाएगा, मैं भी जाऊंगा. अपन दोनों मिलकर कैडबरी खाएगा. Cutaneous tuberculosis. One has to pick it out. Not easy. Somebody will apply antifungal, out of 10, 10 marks. Keratolytic agent, out of 10, 20 marks. Steroid, out of 10, jail. Because it will flare up. Skin biopsy was done. Turned out to be lupus vulgaris. I made a spot diagnosis. I got my Cadbury. Plus, most important, case for you. This is not Cadbury. This is not case. I can mint money on this presentation. Like I am making. Are you going to give me money or no? Aditya is not telling anything. So anyhow, lupus vulgaris. At least 6 months anti-cox treatment. Oh, this is. खुशी का ठिकाना नहीं रहा. See, I am not a qualified MD dermatologist. God is great. Average 3, 5, 7 difficult cases of skin comes to my OPD. I have only my morning OPD. I am very happy. If I see this type of one case, I tell my wife I am coming home. No 2, 3, 4 o'clock. I am coming right now. This is wonderful. Anyone please. Don't go by heading. Go by clinical picture. What you are seeing? What's लगता है what's? अरे हाँ तो बोलो ना मैडम जी, इतनी खूबसूरत मैडम जी आप बोलो तो से कुछ तो. Yes, it looks like what? Huh? It looks like what? This is again tuberculosis of skin. Name are not important. Lupus vulgaris, tuberculitis, tuberculous ulcer, scrofulloderma, Verusa, cutis vulgaris. These are all a game plan by dermatologists, bombarding big name. Stick to your Ayurveda, Vata, Pitta, Kapha, 3 qualities, their defect. Go around that. Basics. Don't go by big name. Hey, दोस्त पीछे का वापस यार. आगे कुछ बताना है 1 minute commentary. So this patient was referred by me to a dermatologist for biopsy. Further work revealed that this gentleman also had tuberculous osteomyelitis of metatarsal bone. 2 metatarsal bones were involved. So dermatologist, biopsy, orthopedic team, anti-cox treatment for full 1 year. Whenever TB infection of bone, 1 full year. Aggressive, wonderful case. This is a wonderful case. You don't see tuberculosis of skin very frequently by a non-dermatologist. By a dermatologist, they hardly see also 1 case in a year. I will ask Dr. Aditya, how many cases you have seen? 1 or 2. Very good, excellent. Next one, please. Difficult, but I can give you 10 differential diagnoses. But it was again a case of tuberculosis of skin. Oh, this is good. I think Aditi had given me this case. At presentation, can you see just above the lip? See after anti-cox treatment, better. See after just 3 months, healing. If this case comes to my OPD, and I am not alert about the symptom, about the morphology, about the theoretical background going in my brain, I am going to miss this diagnosis. Maybe lip dermatitis or some unusual fungal infection or something like this. Wonderful. Thank you, Aditya. This is wonderful case. Have a pause for 10 seconds. Difficult. By just imagination, by image, difficult. Eczema, fungal, non-specific dermatitis, drug eruption. We know this much only in dermatology. और पेट भर जाता है. उसने बोला ना 1 रुपये में 80 पैसा तो अपन डरमेट में बिना अक्कल के कमाता है, लेकिन 20 पैसा कमाने के लिए बहुत ज्यादा अक्कल लगती है. एक स्लाइड आगे देखो दोस्त, थोड़ा और ये I don't do locum. Very arrogant person. I got my certificate 1980 में. उसके बीच में बच्चा भी पैदा हो गया था, सर्दी मेरा. सोनल नाम रखा, सोनल क्लिनिक, एंड आई स्टार्ट माई प्रैक्टिस. बट मेरा ही फैमिली डॉक्टर कुछ राजस्थान जाने वाला था, तो उसने रिक्वेस्ट किया कि सर थोड़ा लोकम कर देना. मेरा क्लिनिक चालू नहीं हुआ था तब तक. मैं बोला चलो सर मैं करता हूँ. नो एक्सपीरियंस. सो वन दिस जेंटलमैन, मोमेंट टाइम इज ओवर, यू लेट मी नो आदित्य. हाँ फिर. सो लोकम के टाइम एक भैया पेशेंट आया और मुझे कुछ नहीं करना था. कंपाउंडर आके ड्रेसिंग करता है, उसका वो करता है. मैंने कंपाउंडर को बोला ये सब कितने दिन से चल रहा है, और वो कुछ 10-15 रुपया उस जमाने में लेता था, या 5-10 रुपया. बराबर अपना रेगुलर पेशेंट है सर, बस बराबर हो रहा है. मीन्स आई एम नॉट सपोज टू डिस्टर्ब. तो मैंने बोला अभी जैसे दरवाजे से बाहर जा रहा था मैं वापस हो गया, बोला एक काम कर, इधर आते रहना, सर आएंगे वापस राजस्थान से 4 दिन के बाद या 5 दिन के बाद, ये तो कुष्ठ रोग है, दिस इज नॉन हीलिंग ट्रॉफिक अल्सर, गो बाय अप्रोच ट्रॉमा, go by approach tuberculosis, go by approach leprosy ulcer, go by malignancy, go by some other rare ulcer. इस भैया ने बाद में मेरे को फ्री ऑफ चार्ज भाजी दिया था, उसी के क्लिनिक के थोड़ा आगे उसकी भाजी की दुकान थी, मस्त था, जब भी जाता था सलाम मारता था, डेप्सॉन और रिफॉर्म पेशेंट नीड ऑफ एन आवर। आई लोली एकदम बिज़ार है, वो नहीं बरोबर नहीं है, but just imagine, 2-3 millimeter, 2-3 millimeter, 2-3 millimeter, 2-3 millimeter, no anesthesia, sensation are still preserved. How many of you know leprosy? Indeterminate, tuberculoid, borderline tuberculoid, borderline lepromatous, lepromatous leprosy, neuritic variety. I am so lucky, I had seen almost all varieties of leprosy cases, almost all variety, at my private practice level. जरा उसको पालेगा ऐसे कर चला, इतना भाग मत ले, अपन बीच में बंद कर देगा. Message is very loud and very clear. We know about ulnar nerve, we know about lateral cutaneous nerve of radial nerve, we know about auricular, we know about facial nerve, we know about peroneal nerve. Some of the patches, आपने वो सीखा था ना, सिंगल मल्टीपल पैचेस, लॉस ऑफ सेंसेशन, देन लेप्रोसी एंड ओनली लेप्रोसी. नो, देयर आर मेनी वेराइटीज ऑफ लेप्रोसी वेयर सेंसेशंस आर इंटैक्ट, almost preserved. Next one. Oh, wonderful. Can you see someone, you will think it is tendon or some vein, it is thickened now. Difficult, but go ahead. Simple. Nodule infiltration in India, loss of eyebrows, leprosy. Oh, classical. Aditya, na? Aditya? Yes, your case, na? Yes. If you do not know your leprosy, you will think drug eruption, you will think fungal infection, you will think healing phase of psoriasis, leprosy. Oh, wonderful. Love this piece of paper. Test, result, unit, our friends. Smear examination, Grimstead, no organism, skin clip for AFB, Mycobacterium leprae. Right ear lobule positive, left ear lobule positive, right eyebrow, left eyebrow, right hand, left hand, right leg, left leg. Classical, documentary, confirm the case of leprosy. Next one. Next, leprosy. This one. See, this you should pick up. Now pause. Just 1 week before only. Can you see the ringworm like on the face, on the abdomen, on the chest? Next one. Tinea pluris. Every day in rainy season you will see. I don't see much cases of malaria and dengue and this and that. Only and only. पैसा पेट भर जाता है रिंगवर्म देख करके. अब रिंगवर्म देखो, गीली चड्डी बनता है, में नहाने के बाद है ना, बदन सुखाने का तो अपने आप सिस्टम ही है जा रहा. वो गोविंदा का मूवी था ना, ब्रश उधर करता है उधर. फास्ट लाइफ, सॉरी. They are not diabetic, they are not HIV positive, they are eat and clean like you and me, but don't understand. You will see every day, whether it is rainy season, winter season, summer season, घर में एक को अच्छा होता है, दूसरा तैयार, दूसरा तीसरा, extensive ringworm. I had seen only ringworm on face. Sometimes I get confused. नीचे का भाग एकदम normal, थोड़ा सा प्रॉब्लम होता है. फिर भगवान का नाम लेकर के देता है एंटी फंगल, या तो गाली देगा या आशीर्वाद देके जाएगा. नेक्स्ट वन प्लीज. दिस इज वेरी गुड. थोड़ा उसको क्लियर किया होता तो मजा आता. दिस वन, बट एनीवे, कैन यू सी डॉट 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 डॉट. टेक्निकली ये कुछ नहीं है, मस्कीटो बाइट है।